Buenos dias. My name is Maria McMahon. I'm the Trauma Program Manager at Boston Children's Hospital, and I'm proud to say that I'm a Trauma Advanced Practice Nurse. Currently, I'm the President of the Society of Trauma Nurses, a premier nursing organization whose mission is to ensure optimal trauma care locally, regionally, nationally, and globally. I'd like to thank the Pan American Trauma Congress for inviting me to speak today. It is truly an honor. I have no relevant financial relationships with manufacturers or of any commercial product and or providers of commercial services. I do not intend to discuss an unapproved investigative use of commercial products or devices in my presentation. Just wanted to start out by giving you a little bit of a historical perspective. Advanced practice registered nurses have been members of the healthcare workforce in the United States for over 50 years. Initially, their scope of practice was in primary care. Then around 2003, when a restriction in the number of physician resident work hours was implemented, there was a demand for more APNs in an expanded role. Since then, the benefits of advanced practice nurses in the care of the acutely injured patient, spanning the continuum from admission to discharge, has been valued and widely recognized in patient outcomes and through research. So advanced practice registered nurse term is an umbrella term, okay? In 2008, a consensus model provided a framework to better regulate roles and patient focus. So the APRN was categorized into one of four roles: the nurse anesthetist, the nurse midwife, the nurse practitioner, or the clinical nurse specialist, all with a different focus and a scope of practice. So this provided a clear educational plan to ensure that each patient population is under the care of the appropriately trained advanced practice nurse. So implementation of the consensus model required that certification exams evaluate the basic competencies. And they evaluate the basic competencies for the APRN as well as the population that the practice focused on. It ensured that the education and the selective certification exam were equal. And it finally made sure that ongoing competencies of certified individuals was done by a national certification accrediting organization. And it also ensured that the competencies were maintained through re-credentialing, whether it's annually or whatever period of time the organization that does the credentialing determines. So the scope of practice, the privileges for writing prescriptions, as well as the degree of autonomy for advanced practice nurses really can be subtle depending on what part of the country or what part of the United States somebody works in. But all are licensed to perform assessments, to provide diagnoses and interpret lab studies and diagnostic studies, and to perform procedures. So in this presentation, I am going to talk about advanced practice nurses, but please know that is further defined in the United States as a nurse practitioner. So the nurse practitioner, the population focus for a trauma nurse practitioner is the injured patient. The specific scope of practice for trauma APNs extends beyond the acute care arena to include care across the continuum. And this means from resuscitation in the trauma bay or resuscitation if it should happen at any time along the continuum, in the intensive care management to home reintegration, whether that's in the workforce or back to school, and then also to include outpatient follow-up. So why a trauma advanced practice nurse? I really like this quote, the best way to predict the future is to create it. I thought this says a lot about what the development of the trauma advanced practice nurse role would and has accomplished over the years. The role was developed not only to meet a staffing need, but to improve trauma team collaboration and teamwork, as well as team communication, as well as rectify some inconsistencies that were happening in trauma care. There was a need for a trauma nurse expert, someone who could be a full partner with the collaborating physician, as well as physicians from multiple services and other healthcare professionals who all are members of the healthcare team with one goal, and that is optimal trauma care for a patient. It really was the right thing to do, both for the patient as well as I'll talk about further in these slides, ensuring that there is staff satisfaction beyond just the advanced practice nurse. So an APN may work in one area, or they may, such as the ICU, a surgical floor, or the emergency department, or they can cover the spectrum of care from trauma bay resuscitations to outpatient clinic visits. For example, I cover the spectrum. I can respond to the trauma bay for a trauma activation if the resident is in the OR, as well as care for that patient on the surgical floor and see that patient in outpatient clinic follow-up. But the exact role really needs to be determined by several things like hospital size or available resources. So when you think about having a trauma APN on the trauma team, you would think that the ideal candidate would be someone who would have experience as a nurse already, taking care of trauma patients on the surgical floor, in the ICU, or a surgical service. Because there really is a benefit. I mean, a novice or a new graduate APN who has this experience enables it to be a nice transition from the bedside nursing role to the advanced practice nurse role. Some would think it would be ideal for a trauma APN to have extensive experience prior to being hired, but there really is some advantages to training a less experienced nurse practitioner. Because, for example, if they're new to the service, they may not be influenced by another work environment or another hospital. So you can train that person based on your hospital's practice needs. And whereas a more experienced APN from a different service or even a different hospital may have to unlearn certain practices. So for an advanced practice nurse to practice effectively on a busy trauma and critical care service, they do require some additional and specific training. So an APN should be trained on the role that they should perform. And this isn't the same for every person because every person has different prior experiences. Therefore, the education, what procedural training they'll need, and credentialing should be addressed during the interview and hiring process. There should be a practice agreement that anyone who practices in the role can use as a basis for reference. It includes the scope of practice, and that should list the responsibilities such as assessments, diagnoses, treatments across the continuum for traumatic injury, what procedures they'll perform, what quality assurance is required for them, whether it's looking at clinical practice guidelines and reviewing them so that a patient can be treated based on evidence-based care, as well as monitoring of prescriptive practice quarterly or whenever it's determined by a hospital to maintain privileges. A trauma APN guideline should be developed and agreed upon by a collaborating physician and the APN, and these should be reviewed annually. It includes their role in the emergency department or the inpatient setting, and it should include care of multiple diagnoses such as abdominal injuries, head and neck injuries, orthopedic, soft tissue, neurologic, just to name a few, because the nurse practitioner needs to work in a multidisciplinary arena with consults from other services providing input, but a trauma advanced practice nurse should have an understanding about all those disease processes. So this education is done to maximize flexibility because a well-rounded trauma APN can relieve a post-call resident with a seamless transition, or respond to an emergency in lieu of if that resident is otherwise detained, whether in the OR or other doing a procedure. So whether or not the APN is experienced or inexperienced, there needs to be some degree of training and should be anticipated and addressed at the beginning of the hiring process. So here's just a list of some of the commonly performed procedures in the trauma and critical care setting. Procedures that an APN is credentialed to perform should be developed in a stepwise process. And this is done so that they can expand with time and experience. An APN would need to then be able to demonstrate and maintain that competency on a periodic basis. Often it's annually. A wonderful resource for a trauma APN that they should be allowed and in fact encouraged to participate in is trauma simulation, because in trauma simulation, you can practice high acuity, low frequency procedures or situations. You might have a trauma MP that does these procedures on a regular basis, but the simulation helps the one that doesn't have enough experience or an opportunity to demonstrate that competency real time. So what does it take to be a trauma APN? And this is really a question that needs to be asked when an APN is interested in becoming a part of the trauma team. A trauma APN really needs to be able to work in a chaotic environment, cope under pressure, deal with stressful situations, really be able to take care of patients that have multiple injuries or are victims of catastrophic events. They have to contend often with cultural or language barriers, and they should be able to coordinate with doctors, whether it's the collaborating physician or other physicians from different services, other nurses, as well as healthcare professionals who all work together as a team to provide this patient's care. I remember when I was a nurse, I happened to be in the emergency department when a multi-injured child or a multi-injured patient arrived. And I was really amazed at the teamwork that it took to take care of this patient. And then I was fortunate enough to attend the case review and hearing how the trauma systems are in place to ensure optimal trauma care. I thought it sounded like the best job ever. And in fact, I am now, and have been for a while, a trauma advanced practice nurse. And the satisfaction I feel about the role I play and the team I work with really, I think, shows that through to the patient and the care that we provide. And that's what the patient and the family deserve. So what does the advanced practice nurse do? They really play an integral part in patient care management. They provide a clinical expertise, they improve communication among healthcare providers, and they implement their processes on a daily basis, such as rounding and formalizing clinical practice guidelines and discharge instruction sheets, to name a few things. Their responsibilities include rounding on patients, and this is key because they get the plan from the attending or collaborate on the plan with the attending, and they're the voice or the conduit between the physician or surgeon and the patient, be able to explain the plan of care and what the patient can anticipate. They also communicate with the bedside nurse and provide the same for the nurse so that everybody is on the same page. Whether it's wound care or management in any way for discharge planning, writing of the daily notes. There's also the element of tertiary surveys and post-operative evaluations. All these things are multifaceted, and they not only help the trauma patient to understand what the plan is, and even after they go home and come back for evaluation, but to help the bedside nurse understand the trajectory of care and what they should anticipate in the manage of, as a bedside nurse, as well as educating the resident who might be, who often is only a periodic member of the team. They rotate through for a short amount of time, and they need the education on how to care for these patients also. So the advanced practice nurse provides all of that for them, as well as the staff. Really, the advanced practice nurse is that this role is continuously evolving to meet the demands of not only patient care related to volume, but for staff needs and patient and family needs. So how do we know that trauma advanced practice nurses have are a benefit or make a difference? Multiple studies assessing utilization of advanced practice nurses in trauma and acute care settings have been done. They demonstrated a decrease in hospital and ICU length of stay. And there's been studies that have been done comparing APNs with physicians, looking at procedural outcomes. These include assessing complication rates and proper placement of thoracostomy or intracranial pressure monitors. The results of these studies show that there is really no statistical difference between those procedures and outcomes. Also, adding an advanced practice nurse to a trauma team has resulted in decreasing the length of stay in all 4 of the injury severity score groups, while providing a core and consistent member in a revolving trauma service. So there was a landmark study by Spiso in 1980 that found the use of advanced practice nurses was associated with decreased average length of stay of seriously injured patients from 8.1 to 7.05 days, while the length of stay for other patients not cared for by an advanced practice nurse remained unchanged. And then there was another study by Fanta in 2006 that further demonstrated a significantly shorter length of stay and a higher patient satisfaction rate for patients cared for by trauma APNs compared to a group of patients that were managed by residents at the same institution. So the length of stay for the patients managed by the trauma APNs decreased from 4.57 days to 2.65 days 1 year later, despite the fact that they had a overall increase in injury severity score. So nurse practitioners, it's been shown provide a cost-effective yet comprehensive medical care complemented by holistic nursing approach, right? So that's what we do as nurses. The Society of Trauma Nurses position statement in 2009 endorsed the utilization of advanced practice nurses as clinicians for trauma services. So, basically said a well-trained APN is an investment that adds value to a trauma service. They're not used to replace residents on the trauma service, but to establish a credible long-term resource as an addition to the physicians. They're an integral part of the team, and they provide a daily continuity and continuum of care. So the trauma APN is a leader. So they're a master of the clinical practice guidelines, and they are a resource for other members of the team, particularly the resident physician who may only rotate through the service periodically. Trauma APNs have the responsibility to facilitate the learning and the development of that physician in training. Trauma APNs are the common thread that ties the patient, their family, and the attending physician together. So they work in partnership with the trauma surgeon and lead the plan of care. They're a real-time resource for the bedside nurse, providing trauma education and information such as the normal injury physiology, diagnostic indicators, and again, the trajectory of the plan of care. It wouldn't be unusual to help a bedside nurse and explain to them how, why, looking at a CT of an abdominal injury and explaining the physiology of care. It's done in our institution all the time. They're the ones who communicate with the multiple services to coordinate care so the patient and family have a point person, right? So many people are telling them so much information. It's good to have one person who can explain and answer questions about what's going on. The holistic approach emphasizes on communication and this attention to detail, and the flexibility and availability of a trauma APN has a substantial impact on not only the patient outcomes, but it also gives an element of staff satisfaction, being able to have someone who they can go to and have questions answered. So over the years, the trauma APN role has been utilized more and more as hospitals have developed and evolved the role to adapt to the increasing number of injured patients and the need to expand the trauma team. The trauma APN has become an essential component of any trauma team, and with the support from nursing administration, trauma surgeons, and the hospital staff, have really come a long way. The trauma APN, when utilized to the extent of their licensure, strengthens the trauma, critical care, and/or acute care service, surgery service. So, over the last 50 years, of the professional experiences that have been evaluated, it's shown that there's done it's constantly being evaluated, and there's an evolving scope of practice. But really, the bottom line is trauma APNs are used as a valuable asset to any trauma team, and they really do make a difference. Thank you for your attention.